is Alexis. I'm going to be your nurse today. The doctor has put an order in for me to do an NG tube, which is a nasogastric feeding tube that goes down your nose to the back of your throat and into your stomach to help you get necessary nutrients that you are currently not receiving. So while I put these gloves on, can you verify your name and date of birth for me, please? Great. It is nice to meet you, Miss Tillman. So I'm going to quickly raise up your bed to a high phallus position, which is a 90-degree angle, and then I'm also going to remove the pillow. It will help make the procedure a little less painful for you, and it will also help me be able to get the tube down your throat correctly. That way it can get to your stomach safely. So let me just remove this pillow, and then we can go from there. So I'm going to quickly drape you with a towel. That way, if there is any mess to be made, it will go on the towel and not on you. There are a few complications with this procedure, so if you feel any difficulty breathing or speaking, feel like you have to cough and you're choking or need gas, let me know and I will stop the procedure immediately. And if I see any signs of cyanosis, which is when you'll start to turn blue, I will also stop then. So this is a spit basin, so if you feel nauseous or need to throw up at any time, just let me know and we can pause so you can throw up. Before I start, do you have any allergies or any past nasal surgeries that I should know about? Great. I also have this water here for you because there is going to come a point in the procedure where I need you to take a few sips. That way I can get the tube further down your throat. So before we get started, I'm going to check your nostrils to see which one is easier for you to breathe out of. So can you take a breath? And one more. Great. We're going to use your right one for the procedure because it came out better. So I'm going to quickly measure from the tip of your nose to your earlobe and down to your xiphoid process. That way I can get an accurate measurement as to how far down this tube needs to go. Tip, bottom, and xiphoid. Cool. So I'm going to quickly take this up and then I'm going to lubricate the end of the tube about 2 to 4 inches. That way it'll be a little easier to go in and it'll be a little less painful, and then we can get started. Great, so now we're going to get started and I'm going to ask you to tilt your head back so I can get this in. And now that there's some resistance, I'm going to have you tilt your head forward and drink some water while I get the rest in. Great. And normally we would go down to where we marked it, but because it's a mannequin, it's not going to go that far. So we're just going to tape it here and go from there. So I'm going to tape this to your nose. That way it doesn't try to fall out at any time during the feeding, because if it does, we would have to restart and do it all over again, which would not be fun for anyone. And then I'm also going to take this to the side. That way it's out of the way for anyone who needs to come check up on you. And also you won't have to be staring right at it, so it'll be a little bit more comfortable. And then I'm going to clean you up real fast and let radiology know that we're ready for them to take you to x-ray. That way we can check placement, and then I will be back to start the feeding, and hopefully in a few days we can get it taken out. So I'm going to put the pillow back and go get radiology. Hello, I am back. I have some good news. The doctor has given the order that we can take the NG tube out. So I'm going to just put some gloves on and we can get started. The process for this one is a little simpler than putting it in, but it might be a little bit more uncomfortable for you because it will involve some residual from your stomach coming up with the NG tube, and it will feel like you are throwing up, which might actually make you throw up. So I have this spit basin right here for you if you would need it. I'm also going to put the towel back on you. That way, again, if a mess is to be made, it will be made on the towel and not you. Right. So I'm gonna just take this off real fast. And then as I take this out of your nose, if you can take a deep breath and hold it for me, then we'll be perfect. Take a breath for me. Great, 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 great. And now we just gotta wrap it up real tight, clean you off real fast, and put it away, and that is it. So the doctor will be in to check on you soon, and I will see you later.